Good evening, everyone. I previously recorded the audio to my presentation and forgot to share my screen. So you may see two of my little icons popping up. Allow me to play the audio and present the presentation. Stay tuned. Good evening, everyone. My name is Amber Odom, and I am going to be discussing food deserts and the California Healthy Food Financing Initiative. Allow me to share my screen to pull up my PowerPoint. Food deserts are essentially areas that have limited access to a full-service grocery store with a variety of produce and nutritious foods that are able to allow an individual to have a balanced diet. They often exist in urban and rural areas and are very disproportionate in comparison to suburban areas. The food deserts are often located in low-income communities and with communities of color. In a U.S. Department of Agriculture study from 2010-2015 stated that about 39 million Americans lived in low-access communities to these resources, or communities in which a third of the population was more than a mile away from a supermarket or a large grocery store in an urban area, or more than 10 miles away in a rural area. The impact is, of course, that individuals are unable to get the food that they need. Oftentimes, what's closest to them are fast food restaurants, liquor stores, gas stations with a lot of processed foods that don't provide the necessary nutrients that one is able to have in a stable and healthy diet. This, of course, increases the likelihood for health issues such as obesity, diabetes, heart issues, which makes food deserts a public health issue. This is just a little comic I found that I think illustrates food deserts really well. As you can see, all around the suffering individuals, it's a lot of processed food, fast food, the really easy things, and then in sight is the affordable, healthy food on the horizon, but the other person says it's just a mirage. That's kind of what being in a food desert feels like. You're surrounded by all of this cheap, easy access food, but it's not food that one can really eat every day and that lasts a long time, that's sustainable, etc. So how did these happen? Of course, it did not happen overnight. This first paragraph goes over a brief history of redlining. My following slide explains the same. Redlining was a strategy that was used to restrict economic opportunities for primarily for individuals of color of African American descent. It denied loans for people to be able to move into a more desirable area like the suburbs and things like that. And throughout over time, the people who wanted to live in these areas, they got pushed out into more inner cities or rural areas, and consequently more of the healthier foods and the more desirable chains and things like that got pushed into the suburbs, while the people outside of those areas didn't have those same resources. These two infographics kind of showed a little bit about redlining. The first one says this tract is exclusive and restricted. Of course, it's an African American gentleman looking at that that sign, and then the one on the right, it says the rich get richer and the poor get their byproducts. And this also shows a little bit about the environmental pollution as well, and the industrial smog and all of that, and how that can be unhealthy as well. So I really liked this paragraph here in regards to food deserts and its impact. This is by a a professor named Richard Florida. It says, when it comes to food and nutrition, it's not just that higher income Americans have more money, they benefit even more from higher levels of education and better information about the benefits of healthier eating. Indeed, education accounts for roughly 20% of the association between income and healthy living, according to the study, with an additional 7% coming from differences in information about nutrition. And it enables affluent and educated households to put this nutritional information to use. For one, they simply have more time and resources to devote to their health and well-being. Conversely, lower income people may simply discount the health advantages of higher quality food or see some of these foods like kale or avocado toast as smacking urban elitism. So basically, the more access someone has, the more they're able to utilize it. And of course, the reverse as well. The less access someone has to something, the less they'll benefit from it. So, of course, as mentioned, the less healthy food available, you're going to see more heart disease, risk for obesity, and diabetes. Some determinants when it comes to food deserts include transportation. If someone is unable to travel long distances to go to a grocery store, say to the town over, it's very unlikely that they'll be able to go to that other store. Again, it creates a big barrier if they don't have the proper transportation, maybe there's no bus route, things like that. And also individual behavior choices and diet. And if someone does not have the education to understand proper nutrition, it's very unlikely that they'll be able to have the knowledge to make these informed decisions. And it even says if someone is able to get out of the food desert environment, they may not still have those skills because they've been so used to the previous accessible foods and the convenience of that. Also, with food deserts also connects with pharmacies. Chances are, if there are not adequate food sources, there won't be pharmacies either, which creates a big barrier for those to be able to treat their health issues, even mental health and things like that, which also creates a what's called a pharmacy desert. So the California Healthy Food Initiative, financing initiative was brought into 2010 to bring grocery stores and other food retailers to the underserved urban and rural communities across the U.S., and specifically the California Healthy Food Financing Initiative was brought into 2011 when Governor Brown signed the bill. It was to help create access to these foods and other services to these communities. So basically, the chain is from the farmers to distributors, retailers, and the consumer. One of the distribution recommendations was food hubs, hubs that would be able to distribute food to wholesalers and retailers to provide to the retailers, and then from the retailers to the consumer. And they can exist in things like warehouses or even things like markets, etc., to be able to get the food out to the public. The retail recommendation is, of course, to increase the new grocery stores in underserved areas, full service grocery stores, because, of course, although some markets may have maybe a cart of bananas or apples, it's not going to be but a very short-term solution. So being able to have that full service of, meats and things like that to be able to provide to consumers, it would be, more beneficial. I thought this was really interesting that full service grocery stores tend to charge about 10% less than the small corner stores, and thus bringing more competition to the, let me go back. Sorry about that. Okay. Sorry about that. And then the more competition there are, the less likely that stores will decrease their prices, which will make it more accessible for people to purchase. So that also brings the cost down. People will have to travel less because they actually have these resources in their area. And then another retail recommendation is to increase the healthy food at existing stores, providing more wholesome options other than the processed foods at the stores that are currently there would help as well, rather than easy foods that are full of preservatives, allowing for more variety for people to access, and also from a logistics perspective, for these stores to also have proper storage space, refrigeration units to be able to store more variety of foods that individuals can prepare at their home. The Supplemental Nutrition Assistance Program, or also known as CalFresh in California, as we all know, provides supplemental aid for individuals to receive cash aid. What I thought was very interesting was that at one point California had the lowest participation rate of SNAP, and it was noted that was more than likely due to the stigma of the utilization of SNAP and having an EBT card, things like that. The national average was 83%, and California was at 70 as of 2018, among the 11 lowest utilized states for SNAP. And of course, this would help individuals be able to access more healthy foods as well, because with CalFresh, it only allows you to purchase certain foods like produce and things like that. Of course, not alcohol or paper products or anything like that. This is just a brief summary of the Healthy Food Financing Initiative Reauthorization Act, its purpose, what it is supposed to improve, including the healthy food of low income and underserved communities, to create quality jobs and businesses, to revitalize distressed economies, to support development of local and regional food systems, and to increase the distribution of locally produced agricultural products and to strengthen farm-to-consumer relations. And again, this is just kind of defining what a healthy food retailer includes, including a grocery store, a mobile food retailer, farmer's market, things like that. So I think people oftentimes have a limiting belief on what a food retailer is. It can be very diverse. It's a matter of what products are offered into that retailer. This is a very popular campaign that was initialized in 2010 by First Lady Michelle Obama, the Let's Move campaign. It was to help give education to children and their families regarding childhood obesity, to be active and make healthy food choices, giving access to affordable foods and to schools, and again, just kind of providing more education to families regarding nutrition. This is one of those that came about the finance initiative. Other solutions include having EBT be utilized at grocery stores and co-ops, so that way people are able to get more of those variety of foods with the resources that they have. This is another initiative with California's FreshWorks. It's a loan and grant program that provides financing to food enterprises who work to increase those resources in communities, also including economic development, job creation, environmental justice, and racial and social equity, and stewardship, and local sourcing. The impact, the last data I was able to find was from 2016. Over 800,000 Californians were able to receive the fresh food through FreshWorks. About 1,900 jobs created, and $273 million were raised. These were the target areas including the East Bay, Sacramento, San Joaquin Valley, and the greater LA area, as you can see by the map. Some of the policy development areas I was able to connect to this was that there were a variety of recommendations from the distributors, retailers, and the consumers, and also self-determination from the consumers, also education being a very big component, because again, if people aren't aware of what is around them, it's very unlikely that they'll be able to utilize what they can. Overall, the issue is very complex and requires a lot of sustainability in order for consumers to be supported. Environmental justice, this is just a little info graph on here. Environmental justice is the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. Of course, in a perfect world, there wouldn't be such disparity between those who live in certain areas to have such a basic need, such as food. That's what environmental justice would be like. Unfortunately, there's a lot of work to be done in order for this to be obtained, but everyone has to start somewhere. Those are my references, and that is it. So thank you so much for listening, and have a good night.